My name is Shah. I'm a radiation oncologist at the Cleveland Clinic. I serve as the director of breast radiation oncology, as well as the director of clinical research in radiation oncology. Lymphedema is a life-altering complication of breast cancer treatment, which has associated morbidities and impact on quality of life for patients. In terms of the incidence of lymphedema, it's largely driven by treatment approaches with more aggressive local regional therapies and in some cases systemic therapies impacting the incidence of lymphedema. For women undergoing a lumpectomy with sentinel lymph node, the risk of lymphedema remains low, often under 5 to 10% in most series, even with the addition of adjuvant radiation therapy. However, in women undergoing procedures such as mastectomy with axillary lymph node dissection and the addition of radiation therapy, as well as potentially the addition of taxane chemotherapy, lymphedema rates may exceed 25% as seen in some series. In terms of lymphedema management, it's important to look at both preventative measures as well as screening measures. For patients who are intermediate risk in terms of developing lymphedema, for example, having undergone lumpectomy with adjuvant radiation, including lymph node radiation, or having had radiation and chemotherapy, prospective surveillance using techniques such as tape measure or bioimpedance spectroscopy or pyrometry can be utilized. In such scenarios, patients undergo surveillance every 3 to 6 months for several years, and if changes in their fluid status occur, they're able to then undergo early interventions such as a compression garment, or in some cases, complex decongestive physiotherapy. In terms of patients eligible for preventative measures, we often will use measures such as lymphovenous bypass in patients who are likely to undergo axillary lymph node dissection in conjunction with adjuvant radiation therapy. In these cases, the women selected for such procedures have the lymphovenous bypass performed at the time of their axillary lymph node dissection and often prior to their radiation therapy. Prospective data from multiple institutions have shown the benefit of such approaches with low rates of chronic lymphedema, though long-term follow-up is limited at this time.